Welcome to the Cohort Sisters podcast, where we give voice to the stories, struggles, and successes of Black women with doctoral degrees. I'm your host, Dr. Ijamakola, and today we're going to explore the work and journey of Dr. Kimberly T Arnold, a health policy and mental health services researcher, public health practitioner, and yogi. Dr. Arnold holds a Ph.D. in health policy and management from the Johns Hopkins University Bloomberg School of Public Health, and she specializes in advancing health equity and reducing physical and mental health disparities. With her expertise in community-engaged research, she collaborates with stakeholders, including church leaders, mental health providers, and policymakers, to create comprehensive mental health support in churches. Dr. Arnold's journey, which is rooted in her personal experiences witnessing the effects of racism and trauma in her community, will inspire and uplift our listeners. So welcome to the podcast, Dr. Arnold.
Thank you. So great to be here.
Thanks again for joining us. So tell us a little bit about yourself. Where are you from? Where do you live now? And what are some things that you'd like to do?
Yeah, so I am originally from Sumter, South Carolina, which is a small rural town in the middle of the state. So we're about an hour from the capital of Columbia. And for people that aren't that familiar with South Carolina, but may have heard of Myrtle Beach or Charleston, I'm about 2 hours from Myrtle Beach and about an hour and a half from Charleston. So I grew up on a small farm. So I'm a country girl at heart. And I love all things outdoors. So I grew up working in my family's garden, helping my dad feed our cows, and just really enjoying the connection with nature. So I've always been a person who's been very grounded and have always loved to just be outside. So that's where I'm from. And I right now I live in Philadelphia. So I live in South Philly, which is kind of near the stadiums. I don't know if people are that familiar with Philly, but I'm near like the sports stadiums, and I'm enjoying living in Philly. It's definitely been a change from growing up in a very rural area and now living in a very large urban area, but I am enjoying it. And in terms of hobbies, I love all things fitness. So right now I'm a yoga teacher on the side. So I really enjoy connecting with people through yoga. So I teach yoga about 3 days a week. And outside of teaching classes, I also like to go to classes taught by other instructors. And I also enjoy things like strength training, spa activities. So if anyone out there is listening and wants to send me a gift card, I love spas. No, I'm just kidding. But I really do enjoy just taking care of myself and relaxing. So I love massages, getting manicures and pedicures, and also going to more like luxury type spas where you can kind of spend the day just visiting different saunas and steam rooms, or just having all types of body treatments and things like that. So, and then traveling, of course, is another big hobby of mine.
We share the spa life hobbies. It has been a minute since I went to grad school in New York, and I don't know if you have spent any time in New York, but there is a spa. It's not too far from Philly, so hopefully you can get here. There's a Korean spa in New York called Sojo Spa, which if you've never been to it, you gotta go. You gotta go. It's fantastic.
I love Sojo. I went for the first time in February, and I just went again last month for my Q2 wellness retreat with one of my friends. So I absolutely enjoyed it. So I love Sojo. They have so much to offer. And I also was happy to see the differences between going in the winter and then going in the summer, where they open up a lot of the outdoor amenities. So I had an amazing experience there. Yeah.
I'm so excited to hear that. Because I was like, oh my gosh, I have to tell you about Sojo, because that was definitely a source of calm and rest for me when I was still living on the East Coast. So I'm glad you were able to experience it as well. I forgot to mention during your introduction that you're also an assistant professor. Like, why did I leave that out of the intro? So I would love to know, I'm kind of going out of order now from our questions, but you mentioned that you use this phrase, like you're a yoga instructor on the side. So I would just kind of love to know from jump, like, how do you create time? Why did you feel like it was important for you to do something outside of teaching, research, community practice? Like you're already doing so much. Why add on something else?
I would say the number one thing is self-care. And you all will hear me talk about that a lot during this interview because it's so important. And it's something that I had to learn the hard way because I didn't always take care of myself, especially when I was going through my PhD journey, even before that, honestly. But at this point in time in my life, I have learned that self-care is the best care. And so one of the main reasons why I wanted to become a yoga teacher is because of the fact that yoga integrates the mind, the body, the spirit, and it's truly a holistic practice that brings together all of those different dimensions of our health. And I also see it as a tool for not only healing, but for just general wellness. So even for people that may not necessarily be on a healing journey, whether that's healing from injuries or trauma or just daily stresses. But when we think about wellness, wellness is multidimensional. And I also saw yoga as something that is multidimensional. And so it just really aligned with my own interests. It aligned with my passion around holistic wellness. And because of the fact that I was already doing yoga anyway, just as part of my regular fitness routine, in the back of my head, I had always said, oh, I'm going to become a yoga teacher when I retire. But then during the pandemic, as I was reflecting on my life and my journey, the God was just speaking to me more and more. And he was like, why are you trying to wait 40 years or whenever down the road when you retire? This is something that you need to do now. So I really just listened to the voice of God and my inner intuition. And I was just like, I really want to become a yoga teacher. I didn't necessarily know at that time how I was going to do that. And not too long after, I was sitting down thinking about it, I was writing in my journal. And then an email popped up in my inbox from a local yoga studio. And they mentioned that they were opening applications for the next cohort for their teacher training, which had been shut down during the pandemic. And it was something that they were going to be offering in the fall of 2021. So I just took that as a sign from God. This is my opportunity to really pursue an area of interest and as well as just something that's part of my overall passion around holistic wellness. And I really took advantage of that training and I made the time for it. And that's another really important point is that you have to make time for yourself. Like work is always going to be here. There are always going to be things that we have to do, but if we don't take care of ourselves, we're not going to be here to do the work. So it's really important to integrate self-care, no matter how that looks for you, as long as it's something that's helpful, that's healthy, and something that's going to fill your cup. It's something that you have to make time for. So I started my teacher training in 2021. I finished last year and, haven't looked back. So it's something that I just make sure that I integrate into my schedule. So I block off the time when I'm teaching. And sometimes that means that maybe I have to work a little bit later in the evening on my regular work or just kind of like juggle my schedule around a little bit to fit it in. But I just make sure that I do that because it's a part of my own routine for my self-care as well as something that's helping others.
I love that. So I would love to know more about your childhood and educational journey. How did you become interested in public health? Was that something that, as a little kid, did you know about the concepts of health and wellness? How did you kind of develop an interest in public health as a discipline and as a field, especially around health policy and management?
Yes. So when I was growing up, I've always been passionate about health. So as far back as I can remember, I've always been interested in health. So when I was little, about maybe 3 or 4 years old, I remember looking in a JCPenney catalog. So some people may not remember those really thick catalogs that they used to send out around holidays. For people to be able to order things through the mail. This was pre, the big internet boom. So, because I am a 90s baby. So this was like, before the internet was as mainstream as it is now. So my mom gave me the JCPenney catalog and she told me that I could select one thing. So the catalog was about this thick. And out of all of that, she was like, select one thing that you want for Christmas. So as I was flipping through the toy section, in my head at that time, I'm like, I want something that's, going to speak to my interest around health. Of course, I didn't say it that eloquently in my head as a young kid, but when I selected a doctor's kit that was connected to my interest in health, and at that time, growing up in a small rural town, I didn't have a ton of exposure to various health careers. So the only things that I really knew about as it related to health were careers such as being a pharmacist or being a dentist or a physician. Or a nurse. Like I didn't really know about public health careers. So growing up, I always thought that I was going to become a physician. So anytime that people in my family were sick, I was always concerned about them, wanting to help take care of them. But my real interests were in number one, why were they getting sick? So I had always been interested in what makes people sick. And as I got older, I was looking around in my community and I was starting to notice patterns in my family and in the broader community that there were common conditions that people were experiencing. And of course, my family is Black and the majority of people in my community were Black. So I was wondering at that time, like, is this something that's just specific to, my area in South Carolina? Is it specific to Black people? And the more that I read, the more that I talked with people from other areas, I started to learn that conditions such as diabetes, hypertension, high cholesterol, like these weren't things that were just only specific to my family, but these were conditions that were chronic illnesses that impacted Black people as a whole throughout the United States, as well as when we look at globally, there are different conditions that disproportionately impact Black people. So when I was in undergrad, I was again still on this path of becoming a physician. And I remember attending an interest meeting for the Ronald McNair Scholars Program. And it was a new program that was going to be offered at my university, which was actually a small liberal arts college. But at that time, they didn't have a lot of programs that were encouraging people of color to enter PhD careers. So during my sophomore year, it was going to be the first year that they were launching the Ronald McNair Scholars Program, which has that exact mission to expose underrepresented people of color to careers that you would need a doctorate for. So during that time, one of my mentors at my university had recommended that I attend this interest meeting because she was like, I know you're interested in going to medical school, but some of the questions that you have and some of your interests, I think would do well, within a research career. And I think that it would really support your interests and help you to kind of discover more about the things that you're interested in as it relates to health disparities, which I didn't necessarily know what that meant at that time. Like I didn't know there was like an entire field where people focus on these things. So I went to the interest meeting, and to make a long story short, I was really just surprised by the information that was presented when they said that you could get paid to do research. So I was like, oh, I can get paid to, pursue my interests and to answer the questions that I have. And then they also discussed mentorship, which I didn't have a lot of mentorship at that time. And so I was like, oh, I can get mentorship. And then they said that they would also assist you with applications for graduate school. So in my mind, I'm like, whether or not I decide to go to medical school, if I do choose this path, I'll have support in applying for graduate school. So I ended up applying. I got accepted into the program. And from there, it was just like no looking back. So during the program, I was able to learn more about what it means to be a PhD, what it means to really conduct research, and also how to get into graduate school and that process. And from there, we were all required to do a research internship. And I ended up landing a research internship at the Medical University of South Carolina. Because in the back of my mind, I was still like, if I do go to medical school, at least I can say that I did this research internship and I can connect with some physicians and researchers at MUSC. So from there, I did my very first summer research internship at the Medical University of South Carolina. And because of my interest, I was actually matched with the Center for Health Disparities Research. So in doing that, I was working with a team of predominantly Black physicians, and a couple of them had also had graduate degrees. One of my main mentors there had a master's in public health from Drexel University, which is how I ended up going there. So that's another piece of the journey. And they really mentored me and nurtured me during that summer research internship. And in addition to gaining some very basic foundational skills in conducting clinical research, I was also actually able to talk with them about my true interests, the things that I wanted to do with my life, like the people that I wanted to help. And they actually encouraged me to then apply for a master's in public health, because they were like, your interests fit squarely within the field of public health. You're really interested in disease prevention and health promotion, really understanding the underlying causes of diseases. And you're also interested in using research to address health disparities. And through that, I ended up applying for master's in public health programs. And part of that was due to the fact that at my undergrad, they didn't have a public health major at that time. So it wasn't like something where I could go back and, change my major, because by the time I actually started the Ronald McNair Scholars Program, I was already a junior, and I did the summer internship between my junior and senior year. So, time is running out. I did not want to be a super senior and stay another year, because they were going to add a public health major that following year, which means I would have had to stay in school a fifth year. So they were like, don't do that. You'll have a bachelor's degree. I also had two minors at that time. So I had a minor in health and a minor in African American studies. So they were like, between your major in biology and your minors, plus your research experience in doing the Ronald McNair Scholars and at the Medical University of South Carolina, you'll be a competitive candidate for a master's program. And because of the fact that one of my good mentors had went to Drexel and told me about their focus on community health and really addressing disparities, that's one of the main reasons why I applied for my MPH there, and then just continue the journey from there.
Yes. It's so amazing when when we are able to come across people who, one, have gone before us and can just be like, hey, I know exactly what kind of work you want to do. I know the perfect place for you to do it. And then it works out. So I'm so glad that you were able to be connected to this mentor through the Ronald McNair Scholars Program, and then continue on your academic journey. So you go to college, you get into Ronald McNair, you then do an MPH. Did you apply to a doctoral program right at the end of your MPH? Did you take some time off? Kind of walk us through the master's to the doctoral transition, and love to know more about the doctoral application process.
Definitely. So during my MPH program, again, I was seeking, like, I had the goal at that point when I went through so when I applied for the MPH, I already knew in my head that the PhD was going to be the next step. So I was able to kind of focus on research throughout my MPH so that I could get enough experience to add on to what I did in undergrad to be competitive for a PhD program. Because unlike master's programs, there aren't many slots available for PhD programs. So you have to be competitive. You have to have research experience and alignment with the programs that you're applying for and all of that. So right away, I was seeking mentors. So that's something that is going to be a common theme of the importance of mentorship, because it's really the key. So I was seeking mentors within the faculty of the MPH program. And during my very first year, once again, a new program was launching. So they were launching the Opening Doors Health Disparities Research Training Program, which was funded through the National Institutes of Health. And that was a program that, again, was established to connect underrepresented people of color to research, and specifically having that focus on health disparities research. So it was perfect for me, and I applied for that program, and it was also limited slots available. And thank God I got accepted into that. And because of my interest, I was matched with a faculty member she's still very important to me right now in my life and has helped me throughout my journey through the PhD process. And even now, I still call her sometimes for advice and just to catch up. And so I was matched with her for the Opening Doors Health Disparities Research Training Program. And her work was focused on addressing health disparities through community partnerships. And at that time, she was specifically focused on working with Black churches in Philly. And that was mostly on chronic disease prevention related programs and things like that. So as soon as I started working with her towards the end of my first year of the master's, because I did a 2-year master's program. So towards the end of the first year, I was working with her as a research assistant as part of this program. So I was getting some additional training in health disparities research through different courses, as well as different mentors that would come in as part of the program, as well as additional mentorship from her. And her name is Dr. Nicole Vine. And so through working with Dr. Vine's lab, I had shared with her when I very first started working with her that I wanted to get a PhD. So right away, she was like, these are the things that you need to do. You need to make sure you're doing research and, all of these things. And she was helping me to identify programs that I was interested in. And so I started pretty early. So by the time that I finished my second year of the master's program, I had already had a short list of PhD programs that I wanted to apply to. And after finishing the MPH program, so I didn't go right away to a PhD program from my master's. So I took a gap year essentially so that I could make sure that I finished out my full second year of the MPH program so that I could finish up the study that we were working on, try to get, a couple publications out of it. But then to also make sure that I had time to connect with people at a couple of those institutions, just so I could learn more about the programs, talk to potential, mentors that I would work with in the program, also talk to students that had gone through the program, and then to also get some additional research experience. So I ended up moving back to South Carolina. But prior to moving from Philly back to South Carolina, I applied for a couple research assistant positions in the state of South Carolina because I knew I was going to be moving back. And I ended up getting a job at the University of South Carolina in Columbia, which is about an hour or so from where my parents live. So I landed a research coordinator position there, and they were working on a large scale study that again was working with churches throughout the state of South Carolina to implement healthy policies and practices to prevent chronic diseases. So I ended up doing that for about a year or so while I was applying for PhD programs. And then I ended up getting accepted into my top choice in February of, I think, 2015, and then started later that year.
Yeah. I love how you didn't rush the process, right? And so I love the intentionality behind, let me finish out the work that I'm currently doing during my master's degree so that I can have the time to do the proper research about different doctoral programs, meet people, network, get myself ready. I just love that you weren't like, okay, I know I want to do this, so like, let me go do it. You took the time to do all your research and get all the ducks in the row. One, I think that does two things. One, it makes sure that you are really choosing the best program for you. And so I love that you said that was your top choice. And I'd love to know how the experience was once you got in. But at least you applied to your top. That's what I know, right? But you did your research to make sure that was really the best program for you and for your interests. And then secondly, by taking additional time to get more research experience, you make your application stronger. So I think that's like a lesson for folks to not rush the journey, not rush the process. These programs take forever and a day anyway. There's no need for you to rush into it without doing the proper research, and also without making sure that you're preparing yourself professionally and academically to have as strong as possible of an application.
Definitely.
Yeah. So let's talk about the program itself now. What it was your top choice after you finished. Did you think it was the right choice for you? Were you happy with your decision to go there?
I still think that, so I would say yes. Like, I still, at the end of the day, think that it was the right choice for me to go there because it was the number one school in my field. So I think that it still was right for me because of the well rounded education that I received. I met a lot of great people, both faculty members as well as fellow students. And I also got a really great education out of it and a lot of great experiences. And it's not to say that I wouldn't have gotten those experiences elsewhere, but I can't speak to that because that didn't happen. But I think that it was a really great learning experience. And I definitely would say that I grew in so many different ways, both professionally, personally, spiritually, all different areas of my life. So the person who I was entering the program was not the same person that I was when I finished the program. And I would say that it was important for me as well to be in a place that was flexible enough for me to be able to kind of pursue my different interests because I've always had so many different interests within the field of public health as soon as like I found out about it and found out about how vast it is. But the common thread has always been addressing health disparities. And at that time, there were researchers that I really admired and still admire to this day that were doing health disparities research. And the way that they were going about doing it was really inspirational to me. And so, and it really helped to kind of widen my eyes to a lot of things because another thing that set that particular program apart was the fact that you had to have a master's to even be accepted into the program. And they were kind of looking for people with a little bit more experience, either through your education, working, or both, and really being able to help you think through the different ways that you can use your career and really use the education that you are receiving to actually impact populations, like entire populations, and not having to stay kind of in a theoretical space. Everything was very applied, very practical. So those were things that were also really important to me, to not necessarily be in a traditional quote unquote educational or academic space where they're trying to get everyone to go into a tenure track faculty position. So, because some people from our program went into government or into academia or into industry, like it was a whole range of things, and they weren't trying to box you in to be a certain way or to do a certain thing when you finished. And so, so those are things that I really appreciated as well. But there were definitely some challenges, along the way. But I wouldn't change anything. Like I wouldn't like go to a different school. I was still, because of the fact that I did learn a lot, and it really helped me in a lot of ways to just grow and to be the person and the researcher that I am today.
Right. Yeah. You started hinting at challenges. Can you share with us one high point from your doctoral journey and one low point? So one success and one challenge while you're getting your PhD.
Well, the biggest success was finishing. No.
Everyone always says that. I'm like, we know. But it's still an accomplishment. It's a huge accomplishment still. Yeah.
Yes. But I would say one of the biggest successes was doing an additional like pre-doctoral fellowship that again, so another common thread that you will probably notice is that God just placed me in these places at the right time, literally when like new things were launching that I was able to take advantage of, and they were things that I needed at that point in time in my life. So I think towards the end of my second year in the PhD program, as I was getting ready to enter the dissertation phase, my department, which was the Department of Health Policy and Management, launched a brand new pre-doctoral and postdoctoral fellowship program. So it was a National Institute of Mental Health fellowship program where they accepted a couple pre-docs and a couple postdocs each year to focus on mental health services and systems. And that was the piece that I needed because it wasn't something that was necessarily ingrained within my master's or my PhD. Like I learned a little bit about mental health during my master's program because I took a course on trauma, violence, and public health. But during my PhD program, there weren't any courses that were specific to mental health until I got into this pre-doc fellowship program. And that literally was the piece that I needed because I had so much background and training already on the physical health side, and I was starting to become interested in mental health. And I was like, well, how am I going to gain, some foundational knowledge in this to actually be able to go out and have that as part of the work that I do? So that was definitely an extreme high point for me, because it was also something that provided additional funding for me, which that brings me to, which I can talk more about that, but I do want to make sure I cover the challenge. The biggest challenge for me was that my original PhD advisor left my first year.
Ooh, okay.
And that was a huge reason why I accepted that PhD offer at that particular time. Because initially, when I got accepted, I was actually going to defer for a year because of the fact that I was really enjoying working with the Faith, Activity, and Nutrition Study at the University of South Carolina Prevention Research Center. So I was enjoying connecting with different churches and community organizations across the state, and that's my home state. So yeah. I really wanted to continue doing that work. But when I flew to Baltimore to meet with some of the faculty in the program, and to meet with the faculty member that had agreed to be my advisor, I was like, this was like a dream for me, because I had already read about him for years. I had already been following his research, and I wanted so badly to be mentored by him and to learn from him as, an advisee and a mentee. But unfortunately, when I started, he had gotten an offer to be a chair at another prominent school of public health and ended up leaving. And that was such a challenge for me. Like, I really struggled because I had to find another advisor, which thankfully he recommended another amazing professor who ended up being my advisor, and who is also she's still a mentor to me to this day as well. But it was still like hurtful, I guess, because I really wanted him to be my advisor, and I still was able to work with him a little bit during my second year. But then he went on to get a dean position at another school of public health and moved to a whole complete different area in the United States. But that was very, very challenging for me, just trying to navigate that process of getting another advisor. And then I would say a second biggest challenge was funding. So originally, when I applied for the program, they thought that I was fully funded because I was a Bill Gates Millennium Scholar from the time I finished high school all through undergrad. So the Millennium Scholars Program paid for all of my undergrad costs, paid for the majority of my master's education, and they had made some changes to that program throughout the years. And so by the time that I had applied for my PhD program, my program that I was applying to, they had experience previously with Gates Millennium Scholars. And, prior to me applying, they used to fully fund graduate education. But along the way, so that they could accommodate additional scholars, they started capping graduate funding. So even though my program didn't know that at the time, when they sent the acceptance, they were like, "Oh, we're so glad that you are going to be fully funded through the Gates Millennium Scholars Program." And I was like, "Wait a minute, there's a disconnect here in communication. It's not fully funded anymore." So I shared, but by the time they had sent that the letter stating we're glad that you're fully funded, etc. That came after my initial acceptance, because I got the early acceptance, and then like a few months down the road, when they were talking about the funding and they sent the funding letter, they're like, "Oh, we're glad you're fully funded." And I'm like, "But I'm not though. So we need to discuss this." But unfortunately, it was too late in the year for them to, because they had already promised other students funding and things like that. So me getting that pre-doc fellowship, that took a big load off of my shoulders. So not only professionally, but also financially, it was a huge success because it made up for that gap of funding. So prior to that, I was working a lot trying to, pay for my living expenses, and everything wasn't covered. Like, thankfully, a lot of the tuition was covered, but because of the school that I was going to, tuition was a lot. Okay. Yeah. So it was very expensive, and even though I had a lot of money, it wasn't enough money. So yeah, but everything ended up working out. And so those are, tips that I would say as well. Just make sure that communication is clear. Make sure that you are fully funded, because there's no reason why anyone should have to pay for a PhD, because you're supposed to be getting paid for the work that you're doing. So yeah.
Yeah. Oh gosh, I'm like having heart palpitations for you getting that letter and being like, "Ooh, actually, actually no." But
Yes.
glad that everything, as you said, things continue to fall in line for you. You clearly have a lot of favor on you. I love that, and so excited to kind of hear you reflect on the different steps that really seem like divinely appointed steps to get you to where you are today. So would love to know kind of what motivated you to specialize in community engaged research, especially research in the church, and how has this helped you address health disparities?
Yeah, so, and this is also connected to the question about, my interest around health policy.
Mm-hmm.
So, going into the field of public health, I had, of course, been interested in addressing health disparities. And the more that I learned about health disparities, the causes of health disparities, and the solutions in ways that we can reduce and eventually eliminate disparities, all of that comes down to multi level strategies, because of the fact that there were multiple things that contributed to health disparities. So, of course, there are going to be multiple things that are going to be the solutions. And so, for my work and my interest, it fell into those two buckets of community as well as policy. So, we know that top down approaches are helpful in some situations, but they're not always helpful, especially when people that are impacted by disparities are not part of the policy making process. And then a lot of the unintended consequences of policies disproportionately impact us. So that was one of the reasons, because of the fact that a lot of times policies are not being made with us in mind, or not including us in that process. But then also, a lot of policies aren't made based on evidence. So sometimes the evidence that is being used, again, may not have included Black people or other people of color or other marginalized populations in that process. So that was one of the main reasons why, I was interested in health policy, because of some of those reasons, as well as when we think about when you set policies, they impact, a lot of people. So a lot of times, when we think about policy at the local level, the state level, the federal level, there are all these different levels where policy impacts our daily lives, whether we realize that or not. So that was one of the reasons why I was interested in that path. But then again, the community is my heart. So like, along the way, I've always been doing community engaged research, because of the fact that it's something that is of interest to me. It's something that even goes back to what I mentioned earlier around me looking around in my own community, like what's contributing to these health conditions that we experience. And we know that policies contribute to our health, but we also know that there are a lot of other things in our community that contribute to our health. So in the field of public health, we call social determinants of health the things that are all of those non-biological or non-medical factors that can contribute to our health. So things like our environment, whether that's the physical environment, whether that's the natural environment, the man-made environment, like all of these different environments that we interact with on a daily basis can contribute to our health. We know that socially, there are different social components. So even when it comes to racism and discrimination, those things can contribute to negative health outcomes. When we think about economic factors, so your education, the work that you do, the income that you make, all of those different factors can contribute. So, and I can go on all day talking about these things, but at the end of the day, it just comes down to how, when we look at the causes of health disparities, policy is going to touch a lot of those things, as well as community. So when we think about sources of strength, we can also gain a lot from our community in terms of that social cohesion, or being close to people in our community, getting social support. And that is something I realized early on, even in doing certain research studies, where we found that social support was something that had contributed more than just even access to health services, or just simply telling someone and sharing health education with them about ways they can live healthier or ways that they can prevent diseases. When those things are done within the context of a supportive community, people are way more likely to adhere to the things that they're learning, or the things that you're sharing with them about how they can be healthier. And then another thing is just that when we look at anchors of communities, a lot of times in the Black community, the Black church has been an anchor historically, and even now to this day, churches are an anchor. So we know that the Black church has that history of social justice, of providing alternative systems of survival when we were cut out of, you know, the mainstream, when we weren't able to receive medical care from the same places as white people, when we weren't able to sit in restaurants or to get jobs from certain places. The church has always been there to fill in the gaps and to also be that source of strength. Like, many Black churches are behind starting many Black colleges and universities. So it just touches so many aspects of our history. And even now, churches do a lot to address social determinants of health. So churches do things like addressing food insecurity. So I'm on the board of the Black Church Food Security Network, which really focuses on co-creating agricultural systems within communities and not waiting around for, people to give us food. We help people to grow food, helping churches to start community gardens, or to connect with Black farmers, and to also figure out ways that we can grow our own food at home or at the church. So helping churches to start community gardens and different things like that. So as it relates to different aspects, when you look at the different types of social determinants, I'm pretty sure I'm not even gonna say I'm pretty sure, I am sure that there are many churches that are addressing those different areas and really helping to support the health of the church members, but not only the church members, but also people within the local community that may not even be a member of the church. So right now, I'm working with churches around mental health, because that was something that during all the work that I did with churches leading up to my Ph.D. program, a lot of that was focused on chronic diseases and really, figuring out ways to help churches support the health of their members as it relates to physical activity or nutrition, and other risk factors for chronic diseases. But mental health was something that was kind of left out of the picture. And so just in hearing directly from people that I was working with through those programs, and they were saying that, I'm depressed, or I'm anxious, or I've experienced trauma, and knowing that many of the programs that we were delivering weren't set up to address some of those things. So just taking that more holistic view of health and really working with churches to enhance the mental health support that they may already be providing in informal ways, and just figuring out ways for us to build upon that, and to figure out what are some mental health programs that we can provide in the church, and how to strengthen connections with local mental health providers to provide additional layers of support when needed, and for people to also access services that they may not be able to access within the church. So at the end of the day, the community is my heart, and those bottom up and grassroots approaches are so important when it comes to health disparities. And again, we have really everything that we need within ourselves and within our communities to address health disparities. And it's not that we have to wait on the government, or we have to wait on even services like health services or health providers to do these things. There are many things that we can do on our own, within our homes, within our churches, within our schools, and other spaces where we may spend the majority of our time, so that we can better focus on our health and better support our health.
Yeah. Your passion and clarity about the importance of working with the community alongside them. I love how you said, we have all the tools in order to address health disparities, and also kind of framing the church. I've thought about the church as a social support, and I've seen some of that literature, but I haven't thought of the church as what word am I looking for? as like a provider of health services. So I think
Yes.
that is an interesting framework. And just, yeah, I find your work fascinating. The public health geek in me is like, oh my gosh, I could talk about social determinants of health all day long with you. We can kiki about it all day long. I have one more
Yes.
question about kind of like the yoga piece that I want to ask quickly, and then we will start to wind down. So I think it's really powerful how in the Black community at large, but also in the Black church, how the idea of mental health is becoming more agreeable to be discussed in spiritual spaces. And so I'm kind of curious about yoga because the people feel differently about yoga in the Black Christian church. So I would love to know how you have, if at all, through your yoga instruction, are you integrating yoga or other self-care practices in the work that you're doing in the Black church as a way to improve health, or are they kind of separate?
Yes, I would definitely say that they are integrated. However, there's still a lot of things that I want to do as it relates to yoga that I am planning to do over the next year or so, in terms of more formalizing like a self-care program that can be delivered within churches that includes yoga as an essential piece. And so that's something I am working on right now. But as it relates to just even talking about yoga or sharing yoga within church spaces, so far when I've done it, the churches that I work with have been receptive to it, and I haven't received any pushback so far. And not to say that I've been doing this with, hundreds of churches so far, but only in like a couple churches that I'm currently working with in Philly, and we are looking to spread this more wider within the area, but it is something that they've been more receptive to. And I think it is just because of the time that we're in right now. During the pandemic, a lot of people and institutions started to really recognize the importance of mental health, as well as the different ways that you can support your mental health through physical activity in general, as well as through practices such as yoga that kind of integrate the physical component as well as those mindfulness components that are really essential to supporting our mental and emotional health. So they've been receptive so far. And, but I would say that for churches that may not be as receptive, I would connect it to scripture essentially, because there are a lot of similarities between a lot of the philosophical components of yoga and certain elements of Christianity. So there are some things that are aligned. There are, of course, some things that may be different, but there is some alignment, and I would focus more on those areas that are in alignment. So and kind of connect with them through that space.
Very, very cool.
Yeah.
So we like to end each of our episodes with two specific questions that we ask all of our guests. So the first one is, what is one thing that you would do differently, if any, during your doctoral journey?
I would say the thing that I would do differently was just to be more intentional, because I would say that when I was going through some of those challenging times, I was more focused on like survival, just like, okay, I just need to get through this.
Yeah.
But I would say to be more intentional and to also focus more on my self-care, because I didn't do that enough. I really did not take care of myself in the way that I take care of myself now. And I just wish that at that time I would have prioritized self care a bit more, and then just also been more intentional about how I was spending my time, and just kind of thinking more long term about things. Like even when it comes to publications, for instance, like I could have focused a little bit more on writing, but I was doing a little bit more of working and getting the experience, but not necessarily doing as much writing to increase my publication record. So those would be some of the tips that I would give.
Okay. Well, now that you've done some self-reflection, what is one piece of advice that you have for the Cohort Sisters community, the current Black women and non-binary doctoral students and applicants and degree holders who make up our community?
Prioritize your self-care. Like I cannot stress that enough, because you have to take care of yourself. And I always like to go back to when you're on an airplane and they tell you to put on your oxygen mask first before you help someone else. And that applies to our life, because if you are not taking care of yourself, you are going to burn out. And I have seen that time and time again with other people of color that have gone through PhD programs and were working so hard that they burned themselves out. Like they got stressed out, they had breakdowns, or some of them left their program and had to return later, or it took them a lot longer than it had to. Or they just, when they finished, they were so tired and burned out that they weren't their best selves when they went into their next position. And then continue that process of burning themselves out. And then I do also have people in my life that are near and dear to me that have developed stress induced conditions because of going through their PhD program and not taking care of themselves, and then also not prioritizing their self-care when they finish. So now is the time to prioritize your self-care, because if you can integrate those practices into your routine now, that's only going to set you up for success later. So that's what I would say is the number one piece of advice: prioritize your self-care.
Well, thank you so much, Kimberly, for joining us on the Cohort Sisters podcast. It was really a joy to hear you talk so passionately about working with the community, about working in churches, about your divine steps that have gotten you to where you are in your doctoral journey. And we're excited to continue following along with the important work that you're doing. Thank you again for listening to this week's episode of the Cohort Sisters podcast. If you are a Black woman interested in joining the Cohort Sisters membership community, or you're looking for more information on how to support or partner with Cohort Sisters, please visit our website at www.cohortsisters.com. You can also find us on all social media platforms at Cohort Sisters. Don't forget to subscribe to the Cohort Sisters podcast and leave us a quick review wherever you're listening. Thank you so much for joining us this week, and we'll catch you in next week's episode.